again, I want to express to you our deep appreciation and gratitude for the work that you're doing. You are helping the state through a constitutional process that is important and necessary to help the state deliver services and meet its commitments to the citizens of the state while living within its financial means. And we know you are dealing with some very challenging issues, as are we in the executive branch, and we continue to want to work with you as closely as possible to help us reach the best decisions and the best conclusion for the state's taxpayers and for the state's residents who depend on the services that we provide. We know that the issue before you today, the Tinley Park Mental Health Center, is one of those very challenging issues. It's a facility that has existed for a long time and provides a high level of quality care to people with serious mental illness and people with mental health problems who are in a crisis. We, in recommending, as the governor did in last fall, and then again in the budget address this year, that Tinley Park close in no way denigrates or challenges in any way the work that has been done out here by the hardworking staff and by the community here who support those staff, their families, and everybody else involved in delivering this care. We know it's very challenging work and we deeply appreciate it, but we also know that we, like everything in life and in government, change is inevitable, and in this case we think we have recommended something that is supported by the evidence about the way we can best deliver care to people with mental illness and the best way we can to finance that care. And for those reasons, we have recommended as we did before, as I said, the closure of Tinley Park. We are not looking at Tinley Park in a vacuum. Tinley Park is one of several facilities that the governor has recommended be closed. We're in the process of engaging in that effort along with other members of the executive branch. Departments that we'll hear from shortly. But we are confident that the facility closure effort that's taking up a lot of your time is one that will pay dividends to us as citizens of the state in enabling us to provide quality care in a more cost-effective manner in the most community integrated and least restricted settings possible, which is what we believe our mandate is from the federal government and from court decisions interpreting laws that have been part of our country's history now for a long time, including the Americans with Disabilities Act. We appreciate the additional funding that the General Assembly provided us in November, which enabled us to keep Tinley Park open throughout fiscal year 12. That we have another 2.5 months left of. We did not have to pursue an urgent immediate closing as had been funded initially by the General Assembly in your budget that you passed last May. And for that reason, we're able to come back to you with a plan that has many of the elements for which we were criticized in the fall of not including at the time, primarily one of taking a reasonable amount of time to develop a plan and to implement that plan before the facility was closed. But as you addressed that issue in November with reallocation of funding, we're able to keep Tinley open through June 30th and are embarking on the plan that we'll be hearing about in just another few seconds. So I want to thank you. I don't want to take up too much time because I think the value of today's hearing is for you to hear from the people involved in implementing the plan to provide services to people who have been patients at Tinley in more appropriate settings, and we'll be happy to answer your questions about the plan or about the governor's motivation or interest in doing this. But please, as you hear the plan and hear the comments, recognize that that we understand how challenging this is. We understand the deep emotional commitment that people here in this community have. We're respectful of that, but yet we think in charging the executive branch as it is, the governor, with making those tough decisions, that we have made a decision that is in the best interest of the state, the taxpayers, and the people who depend on us for services. So let me turn it over now to Deborah Ferguson from the Division of Mental Health and the Department of Human Services.
Good afternoon. On behalf of Director Lori Jones, thank you for this opportunity to provide an update on the plan for rebalancing Tinley Park Mental Health Center and Region 1 South. Since the February 7th CAPTA hearing, the Division of Mental Health, in collaboration with both state and community partners, has done a considerable amount of work further developing, refining, and advancing our plan for rebalancing of state-funded mental health services delivery in the region. Today, Tinley Park has a census of 45. In FY11, there were 1,905 admissions, and in the first 2 quarters of FY12, there have been 694 admissions. All of the persons admitted in FY12 have been uninsured. Approximately 98% of those admitted to Tinley Park are referred by local hospital emergency departments. 17% are experiencing homelessness. As I mentioned in my previous testimony, the majority of those admitted have co-occurring substance use disorders, and with 24% having a primary diagnosis of substance abuse and no major mental illness. There are 165 total staff currently employed at Tinley Park, 147 in direct care, service, or trades positions, and 18 in management or administration. Consistent with the plan to close Tinley Park in early July 2012, on April 5th, layoff notices were issued to affected employees at Tinley Park and DHS employees in Cook County. Additionally, the DHS Bureau of Training and Support Services has asked again to provide support services to Tinley employees, including but not limited to meetings with staff, review of available EAP, PSP services, review of retirement and benefit options, and strategies for managing stress. Also, the Department of Commerce and Economic Opportunity will be meeting with staff and, in collaboration with Cook County Boards, will offer information on job training programs, job opportunities, and job-related resources. As part of the plan for Region 1 South rebalancing, the Division of Mental Health will invest $9.8 million in the community to support mental health treatment services previously provided by Tinley Park Mental Health Center. The foundation of the Community Reinvestment Plan is an enhanced and expanded crisis system focused on providing psychiatric emergency response and supports to hospital emergency departments in the region. In addition to the purchase of acute inpatient capacity in the region, we are also soliciting proposals for new service models to include crisis outreach, brief observation units, crisis residential, and substance abuse residential services, supplemented with access to psychiatry, medication, and transportation. Through the purchase of acute inpatient capacity in Region 1